I'm Dr. Alex and I'm dual board certified in family medicine and obesity medicine. Today I'm bringing you the 7 pregnancy workout warning signs. If you experience any of these signs or symptoms, please stop exercising and call your provider immediately. Number 1, fluid leakage. Now, sometimes it's very difficult to tell if this is actual fluid from the amniotic sac or urine. I myself have had this happen numerous times. Urine will often have a slight ammonia smell, but amniotic fluid doesn't come out in a big gush like it does on TV. Sometimes it can come out in a slow trickle, and this can be a sign of premature rupture of membranes. If you experience any fluid leakage, make sure you stop exercising and call your physician. Number 2, shortness of breath prior to exertion or exercise. During pregnancy, your heart is working hard. Both circulating blood volume and cardiac output increase by 50% and max out at the end of your second and beginning of your third trimester. So if you can't keep a conversation going during your workouts, you need to back off and sit down and give your heart time to readjust. Number 3, dizziness or faintness. Now, sometimes this can be attributed to a low blood sugar, but sometimes it can be maybe you just haven't had enough water to drink today, or it could be that you're doing an exercise that puts you at higher risk of falling. If that's the case, you want to make sure you put yourself in a situation where you're able to safely do all modifications of an exercise. You don't want to put yourself at risk of falling and possibly injuring the baby. Number 4, chest pain or muscle weakness. Now, there is going to be some type of weakness associated with pregnancy, with all the increase in fatigue, as well as the slight decrease in the intensity of the workouts you're doing. But this isn't the weakness that I'm talking about. It's the weakness that's often associated with possibly uncontrolled thyroid issues, anemia. This isn't a weakness that you've probably never experienced before. Now, for us first-time moms, again, that will be hard to distinguish, but your doctor will be following blood work for you, especially at the beginning of your pregnancy. So if you experience this symptom, please bring it up to her or him at your next appointment. Chest pain. This is a big sign that something else could be going on. There could be cardiac and pulmonary issues for chest pain. Women who are pregnant often have higher blood circulating volume and are less active. That, along with an increase in hormone levels, make it a perfect patient to develop something called deep vein thromboses or even pulmonary embolisms. If this were to happen, you would start to experience something like chest pain, and that would be a sign that you would need to seek medical help in an emergent situation. It's right here. It just moves. That being said, you want to try to engage in more frequent bouts of slightly less intense activity instead of fewer, more intense, vigorous activity bouts of exercise. So 3 10-minute walks may be better at increasing your blood circulation than 1 30-minute workout done just once during the day. Number 5, swelling. Swelling can be a sign of something called DVT or deep vein thromboses. This is often seen in the lower extremities because as pregnant women we tend to sit more often. If you notice an increase in calf size, redness, and pain, that's more of a sign that there's a deep vein thrombosis that you need to seek medical care for. The other thing that you need to watch out for is swelling. Swelling can be a part of a DVT, but it can also be a sign of something more serious called preeclampsia. If this were to happen, you would have abnormal swelling that doesn't go away with putting your feet up or after you have slept for the night. And you'll notice a more generalized swelling that if you push your finger in, the indentation tends to stay there. Number 6, decreased fetal movement. Now, sometimes this can be a normal wake and sleep cycle of your baby. It could be a sign that maybe you haven't eaten enough today and you haven't given the baby enough sugar. But it can also be a sign that the baby is not getting enough blood flow and that you need to seek medical care. How do you know the difference? It's tricky. You want to do something called a kick count. What that means is within 2 hours, you should have felt 10 movements of the baby. Any movement counts. What you want to do to elicit this kick count is eat something, preferably something with more sugar, and then go and lay down on your left side in a quiet room. The left side is important because the baby in the uterus is enlarging and you don't want to put any compression on the blood vessels in the abdominal cavity. If you lay on the left side, the uterus does not compress the aorta, versus if you lay on the right side, it can decrease the blood flow out of the lower extremity and out of the uterus and for the baby back up to your heart. If you don't experience 10 kick counts within 2 hours, this is a sign to call your physician or medical practitioner and let them know and seek further medical care. Number 7, preterm labor. Now this seems like a very obvious reason to stop exercising, but the definition of preterm labor is any regular uterine contraction that causes cervical change before 36 weeks gestation. Sometimes this is hard to distinguish from something called uterine irritability, which the uterus, like all muscles in the body, if it does not get enough water, can start to cramp up and cause somewhat regular feeling contractions. I've seen this a lot in patients who haven't drank enough water in the day and their uterus has been contracting and they come up to labor and delivery thinking they're in labor. What you want to do is make sure you're drinking a significant amount of water dispersed throughout the day so that your urine stays as clear and light as possible. If the contractions don't ease up with that, then you want to call your doctor and head over to labor and delivery for a full assessment.
Well, it just like did a twist.
So these are some of the most common warning signs for reasons to stop exercising. This list is not by any means completely exclusive and does not say all the things that could possibly happen. If anything feels off, call your provider and talk to them because they'll be able to further help you work things up or send you to the hospital for further assessment. It could be nothing, but it could also save your life and the life of your baby. Thank you so much for watching. Make sure you like and follow us on YouTube and Instagram and leave any comments if you need further clarification.